Standing Committee on Social Policy's consideration of the 2023-24 expenditure estimates for the Ministries of Health and Long-Term Care. In the 2023 Ontario budget, the government added $15.2 billion in new funding to its health sector spending plan. Based on the FAO's estimate of the cost of current health sector programs and announced commitments, this represents $4.4 billion more than what is required to fund health sector programs from 2022-23 to 2025-26. The $4.4 billion in excess funds is a significant change from the FAO's previous estimate of a $10 billion funding shortfall over the same period. Going forward, the $4.4 billion in excess funds could be used to introduce new programs, enhance existing programs, address spending pressures that could materialize, or improve the government's budget balance. Our report also examines the federal government's contribution to Ontario's health care spending. The FAO estimates that new agreements in principle reached in February 2023 will increase federal health transfers by $7.7 billion over 5 years. This will bring federal health transfers as a share of Ontario's health spending to 27.4% in 2023-24, followed by a gradual decline to 26.1% in 2027-28, as some time-limited funding agreements expire. Thanks very much, and we'd be happy to take any questions.
Can you explain why it's such a stark difference now from a $10 billion shortfall to now $4.4 billion surplus? Is this because of the federal money, or is this just the government changing its tune and all of a sudden committing more? Like, how can you explain that to people?
So in the 2023 budget, the government added $15.2 billion to its spending plan, which effectively covered the shortfall we had previously identified. So that's the main difference, and the government updates its spending plans every year, and so there was a big change in the 2023 budget. In terms of the $15.2 billion, approximately $4.1 billion is connected to the new federal health transfer money.
Okay. And the excess $4.4 billion.
Mm-hmm.
You remarked in the presentations that the government might be facing up 2-point-something billion in wage increases if they lose some court challenges. Do you think that that's what the government's going to be saving its kind of reserve fund for, or any ideas?
So we don't know what the government intends to do with the $4.4 billion, but certainly if spending pressures materialize, that being a big one, that could be what they use the $4.4 billion for. It could also be used for program changes, program enhancements, and if they don't use the money at the end of the day, it just improves the province's budget balance.
For general context, how reliable are the years out budgeting forecasts? They seem to go up and down all over the place. Should we put a lot of stock in the 4.4 over this time period?
Well, I'd say what we're doing is we're comparing our forecast against the government's. Our forecast has been fairly stable last year to this year. It changed by about $800 million over that 4-year period. The government's changed a fair amount. So I think we're pretty close now in terms of our forecast against the government's. And of course, things change all the time. And so we will update our forecast. But the government, of course, can make new program changes, new commitments, and that will always change our forecast as well.
I wasn't criticizing your forecast. No. It was more like the government seems, when it's multi-year forecasts, it's like there's an election coming, or what it wants it to look like, rather than what it will stick to in the years and the budgets to come.
Sure, we haven't analyzed, each budget and how much change has happened. There has been a significant change this time.
Critics might look at this, at these figures, and say, "Oh, that's just allocated. How do we know that they actually end up spending the money?" So how do you ensure that this money actually goes towards what it's been promised for?
I guess that's a good question. When we compare against our forecast, that's how much we think will be spent to fund these programs. And that when we just look at that, we think the government has allocated $4.4 billion more than they need to spend. So if the forecast holds true, then if you look at their forecast against ours, and the government does not make any new changes like program changes or enhancements, then there would be underspending of about $4.4 billion, and that would go to reduce the province's improve the province's budget balance and net debt.
Is it possible to get a few more details on the spending on independent health facilities or the new community and surgical diagnostic centers? The money that's in here, is that something that they've budgeted, and how certain is that? I'm not entirely sure how the funding for those work. So what did you look at when you looked at that part of this?
Yes, I'll start, and then I'll throw it to Matt. But yeah, as we noted, there's been an increase in 23-24 for independent health facilities, and correct me if I'm wrong, but about $200 million over 3 years is included in our forecast. But in terms of the specifics, Matt, do you have anything you can add?
Well, so back a few months ago, the government announced that they were going to do this. They were going to move some cataract surgeries as well as some imaging to provide those facilities with more money so that they can perform more OHIP-insured services. The government did provide some figures around how many. I don't have those off the top of my head, but we are basing this very much on what the government is saying they're going to do. So that $62 million that I outlined in the slide, that's the government's actual spending request. There's not a ton of detail, I think, on exactly what they're going to do, but they did provide some figures that we do reference in this document, or we cite them back in February, I think.
Can you explain the Bill 124 payments, like why, just in kind of layman's terms for people to understand why they've got to pay this money, where they might be vulnerable to pay more? Where is it coming from?
Sure. So I guess just taking a step back, is Bill 124 held or mandated that most broader public sector workers had to go through 3 years of 1% base wage increases, so 1% a year over 3 years. That legislation was challenged and it was ruled unconstitutional at the trial level. That ruling is under appeal, but while that appeal is happening, there have been some arbitration decisions that have awarded retroactive pay increases to some healthcare workers. So we think the cost of those decisions is about $0.9 billion to 25-26 in retroactive pay, and then higher pay going forward. In terms of so the decision is still under appeal. If the appeal is unsuccessful and the final decision is that the legislation is unconstitutional, then the other health sector workers would likely be awarded retroactive pay as well. And we think that additional cost could be, I'm going to say, $2.6 billion in addition to the $0.9 billion through 2027-28.
Could the government proactively use this $4.4 billion surplus to increase wages? I think they'll probably be facing some pressure from some sectors in opposition to, they can use this money for anything they want, can't they?
Yeah, that's right. And so again, when we said what the government can do with the $4.4 billion, one would be to address spending pressures. So if they lose this court case, they could use the $4.4 billion to address that spending pressure. There's also health sector worker shortages that we've identified before. The government may need to increase wages to attract or retain workers, and so they could use the $4.4 billion for that. So any risks that we've identified